we are the Bridgers, and today we're here to talk about an on-demand scientific talent marketplace. And our business thesis is that startups, which is our customer segment, need fast, reliable access to specialized scientific talent for short-term projects and innovation. SciWork, which is our business concept, provides an on-demand marketplace where vetted scientists and researchers offer expertise in various fields, enabling companies to accelerate development, reduce hiring costs, and scale efficiently, which is our value proposition. So what is the problem or opportunity where we see where SciWork can help? That is, so it's estimated that around 200 biotech companies start per year in the US, but only 10% are actually successful. And one of the major factors to that success is finding key talent in a cost and time-effective manner. Here we have an example of a biotech CEO. He's literally walking around campus trying to hire students because he doesn't have time. So as an example, we have a biotech CEO who has a deliverable in a short amount of time from investors. He realizes he needs data analysis and he doesn't have a team member in place to do that analysis, specifically a bioinformaticist. Normally, he would need to reach out to HR. They would need to look for somebody, vet somebody, onboard them. He doesn't have time for this. Then on the other side, you have a postdoc who's a bioinformaticist, and she is interested in earning extra income, getting a foot in the door in industry, being closer to R&D and helping real people and patients. But she doesn't know where to go. So that's where we see SciWork is bringing together experts and scientists pool to these biotech CEOs. So this is SciWork, and our mission is connecting specialized scientific talent on demand, accelerating innovation, and reducing costs to accelerate research. Here are some key features about our company, which now our team members will continue to talk about. Thank you.
Thanks. As Lindsay discussed the overview of our company, we're trying to build a strong customer relationship through various types of channels. For customers who are looking for CEOs of small startups, or as well as the leaders in the incubator programs in their biotech companies. We're trying to have different types of channels, such as through conferences or direct sales as well. From there, we're trying to make stable revenue streams, starting with the quote-unquote premium subscriptions. From the first 4 years, we would like to have a small subscription, which will cost around 100 to 200 fees, depending on the scale. But then as we grow, we're trying to have a larger, trying to work with the larger companies. So from there, we're going to have differentiated subscription programs. With that, I will move to the next slide, and then our colleague will continue the presentation.
So I want to share how we ensure startups succeed by focusing on the right key activities and resources. So first, let's talk about key activities. We focus on building a high-quality network of scientists and experts while ensuring a fast and seamless hiring process that delivers the talent that you need when you need it. We also provide guaranteed success metrics so you can trust that we're aligned with your goals. Through strong partnerships and ongoing ecosystem development, you set the stage for long-term success. You'll also receive personalized CEO and startup support, as well as comprehensive risk management and IP security to protect your innovation. Now, to achieve all of this, we rely on our key resources. This includes a vast talent pool of human expertise. So here we have our expertise, alongside an AI and data-driven platform that powers our solutions. Our team is here to provide white glove support and make sure your experience is seamless. We also prioritize building strategic partnerships and integrating you into the right ecosystem. Plus, we ensure everything is backed by a strong legal and compliance framework to safeguard your business. So lastly, our approach is grounded in 5 core principles: speed, quality, cost efficiency, trust and security, as well as ecosystem support. And so with our value proposition, with our platform, you can rapidly connect with high specialized talent without the need for full-time hires or long-term contracts. This flexibility accelerates your R&D and drug development timelines, helping you innovate faster and more efficiently. One of the key advantages is the cost effectiveness. You get access to a flexible workforce, reducing the need for permanent hires, which means lower overhead. For example, the average HR manager costs around $100,000 annually, and the same goes for an entry-level scientist. By tapping into an on-demand talent, you eliminate these high costs and only pay for what you need. And most importantly, we ensure that your intellectual property is protected with robust IP security measures in place, so you can innovate with peace of mind. In summary, our model offers speed, flexibility, cost savings, and a secure environment to help you achieve your goals faster and smarter. To sum this all up, to sum this all up.
Thank you, Nima. So at the end of the day, here's our business model canvas outlining what Bridgers hopes to accomplish with our SciWork platform. So again, helping to streamline and expedite the hiring process, avoiding the HR, which can be time consuming, helps to ensure that the biotech CEOs and other representatives of their respective companies can find great talent in an expedient manner in a way that helps to foster collaboration, innovation, and success in driving their project forward. By helping to streamline this process and to create a large, vast international community of expert scientists and researchers in their field, it helps to benefit not only the company in helping to expedite the progress of their work, but also the other side of the talent pool that is trying to advance their own initiatives and objectives to help them stand out as strong candidates when they begin to transition into the next step of their fields. That's Bridgers, and that is SciWorks. We thank you for listening to our talk today. And at this time, we will take any questions. Thank you.
Yeah, we don't. So on the customer, so you have on one hand the early startup, and then you also talk about large companies. Are you solving for, startups don't usually have a lot of funding when they are early. So I didn't know if you are also sub-segmenting or figuring out if that's really actually even a problem that you can solve, just because if they are an early stage startup, they probably don't have much funding available. And you're trying to say, well, you're providing funding for the professionals because they are gonna get paid doing that. So I was just trying to understand what your thoughts were about that.
So we're providing, we're bringing them the people, the small developers looking for very specific niche problems. Where that's why we're trying to have the subscription where but then the first thing to establish is that the finding the right problems, what they have, and then whether there can be a good match for such problem can be solved through our platform. So that is-
If I can expand on that, you make a good point that if they don't have that much money, which is why we think our platform is so unique, they don't have money to have a full HR staff to then onboard and hire these full-time scientists. We do that. We do all of that at a percentage of what the project costs, So I think it's a very cost-effective way for them to have access to scientists and get the data they need to accelerate their program. And that builds over time. So in the beginning, we go after these biotechs, but as our pool grows and as our reputation grows, we can build partnerships with larger organizations that would pay for a larger fee to have more tools and resources at their fingertips.
Hello, everyone. It's a great pleasure to be with all of you here today. We're going to be talking about our AI-enhanced thyroid biopsy tool and the associated business model canvas concepts. I think all of us here probably agree that healthcare should be safe, effective, and available for all. So now, millions of people each year suffer from various kinds of thyroid issues. And when they have these issues, they're treated by human doctors. And these doctors can be prone to error, they can be slow, they can be clumsy, they can make mistakes. Wouldn't it be great if we could use the power of artificial intelligence in this new age and couple it with machine precision to make these thyroid biopsies more effective, more available, and safer for all? So in lieu of that, we present to you this slogan, humans need, robots yay, and present our rationale about this.
Looking at our value proposition slide, the data clearly shows our AI-guided thyroid biopsy system outperforming the traditional methods across all key metrics. Where it matters most, accuracy, speed, and cost, our solution demonstrates significant advantages. By reducing the staff requirements to just one technician overseeing our AI-enhanced robot, we deliver three essential benefits: enhanced diagnostic reliability through reduced human errors, higher biopsy accuracy with improved targeting and real-time adjustment capabilities, and faster procedures with fewer complications. So the value we deliver is clear. 45% time savings per procedure, 35% overall cost reduction. The seamless integration of AI analysis with ultrasound guidance creates a continuous feedback loop that enhances physician decision-making. So the value is clear here. Fewer complications with real-time guidance. Reduced costs by eliminating repeated biopsies with significantly improved speed and accuracy. With that said, the next question we want to answer is, who do we deliver this value for?
So we focus on our early adopters, research institutions, and we're going to identify our key partners. So research institutions will be using this AI surgeon idea as a research enhancing tool for novel publication and research. Endocrinologists with surgeons and thyroid specialists, they make a team and they'll be pairing up as a medical team. Medical regulatory bodies like the FDA will be upholding regulatory compliance. Together with insurance, we have to make sure that the patient's insurance are covered and our liabilities are covered. And with ultrasound imaging companies, we'll be engineering the robot hardware and also develop the software for AI training. And with teaching hospitals, we're going to test the efficacy of these AI surgeons for their usages.
So to determine the profitability of AI surgeon, we look into the revenue channels and cost elements. In the revenue, we consider the major revenue channeling in through selling our robot system. The other revenue channels would be selling the annual software licenses and other services. For cost, we consider the manufacturing and equipment procurement cost as the major cost items. And there are other channels that we have mentioned in the cost section. So we are offering to the 1,000 hospitals in the USA who run the biopsy procedure. We are offering them the value addition in the revenue, about 120,000 USD per year. And even if 10% of them responds to us, we expect the AI surgeon revenue expects to be at least 15 million to 20 million per annum in the revenue.
Yeah, so in summary, Ramon, I just mentioned to you our main costs being manufacturing. And then our main revenue that we're bringing in is from the sale of our actual robotic system and software licensing. Our main customers are going to be research institutions who will be the early adopters of this product and who work with a variety of key partners in pursuing this idea. The value delivered from this product is to make these thyroid biopsies safer, more effective, and more available for all. So with that, thank you, and we'll be happy to take any questions you might have.
So I'll ask, you've got a bunch of value propositions on there. Which one do you think is the most important of that list of 5 things?
I would say, I think the reduced procedural time is probably the most important one out of these. From that reduced procedural time, I think Number one, it's gonna make these procedures a lot faster. And in turn, by making them faster, you can provide it for more people. The faster you're able to do this, I think you can reduce sort of major complications, right? There's reduced risk of infection. The faster you're able to perform this procedure, less time to expose the patient to bacteria and things like that. So that's what I would say.
Hi, everyone. My name is Olivia, and today with my partner Sherry and Biddies, we'd like to show you how Reperio Health is reinventing workplace wellness by putting healthcare back in the hands of employees.
So, health insurance company costs are increasing. They are about $24,000 per employee, and they are increasing about 20% each year. So the companies need to manage these healthcare costs and also improve the health of the workforce. So one of the options is preventative screenings for employees, and they have been shown to reduce by $1,000 per person each year. Our customer segment hypothesis is the VPs of the HR at large employers will drive adoption through benefit budgets.
Yeah, so how does Reperio Health do that? Reperio Health offers at-home biometric testing and screening for employees. And unlike sort of traditional preventative medicine screening, all of this is done at home and it is integrated into the workplace wellness programs already existing with employers. And so the idea is these employees at home are able to take some sort of clinical grade tests, such as testing for cholesterol levels, glucose level, and their data is kept secure. And then that data can be actually aggregated and sent to employers to sort of make various business decisions related to budgeting sort of their wellness programs. And in turn, how we sort of hypothesize with this idea, these values of healthier employees can lead to lower costs in terms of these wellness programs that are already existing in benefits packages, as well as increased productivity and hopefully improving employee engagement in preventative healthcare as well. And so the way Reperio Health does this, their sales model is specifically using a B2B or business to business direct sales approach with the offering of a subscription model. And so the actual kits can be purchased individually for between $100 to $300 for a one-time use, or employers are able to pay on a per employee per month subscription program for $10 to $30. In the buying cycle, we expect these sort of VPs of HR and sort of these leaders of these wellness programs to be purchasing these in Q4 during sort of their benefits planning and budgeting of their year. We're expecting it takes, between 3 to 6 months for really approving these and compliance and getting these actually fully adopted. But we're hoping with growth of our company and this idea, we could potentially partner with insurers and potentially monetize some of this aggregate data as well.
Our market strategy is designed to be efficient to reach and engage our key stakeholder. And we will utilize the direct sales channels such as LinkedIn, conferences, and benefits brokers. And we will target VPs of HR in these through these channels, and to ensure our biometric kits are the primary choice for the employer health solution. And in managing the customer relationship, our approach is simple. So first, to attract our direct engagement, and second, keep to retain through personalized onboarding and actionable health insights, and third, grow to expand our reach through referral incentives for employers and also tailored pricing models. And this strategy not only drives the initial adoption, but also maintain a long-term engagement. And to deliver value to our employer, we prioritize 3 main activities: ensuring regulatory compliance through regulatory experts, and kit manufacturing through reliable supply chains, and the robust employer onboarding by scalable software platform to provide a smooth onboarding experience for the employers.
So to ensure sort of financial viability of Repario Health, we looked at sort of the fixed costs as well as viable costs, thinking mainly about those key activities that Sharon just shared. The fixed costs are specifically regulatory compliance, looking into like sort of HIPAA and various regulatory compliance, and as well as software maintenance and R&D. We're expecting the fixed cost for this to be between $500,000 and $1 million annually. And then the variable costs, specifically manufacturing, shipping, and customer support, we're estimating right now between $100,000 and $500,000 a year. But we expect hopefully as we scale and become more profitable, we can potentially lower the costs that way.
The biggest unknown and risk management mitigation is like the employer-employee adoption as well as long-term engagement with our kids. So basically what we plan to do is we need to have a strong incentive program where the employee who adopts the kids the most gets a financial incentive. And that's how the employees will use these kids from the employers. Seamless onboarding, so we think we plan that these should be integrated during the hiring process with the HR. And third is the data-driven value demonstration is like, it's data-based. So if you use the kids and you improve health, there is less absenteeism and more employee engagement in the company. So that's how you practice.
Yeah, and finally, putting it all together, here's our business model canvas. Again, directly, our customer segment is employers. Yes. Take any questions. Thank you.
I'll go since somebody. So your customer segment's employers. So there's a lot of employers in the world.
What type?
Help me understand what you're aiming at.
Yeah, great question. Specifically, large companies that already are adopting these benefit programs that they typically utilize to be competitive for people that they're hiring. So we want large corporations with lots of different employees that have money.
Hello all, we are Ray Derma. Our product is a stingray venom infused topical anti-aging serum. And our business thesis is that Ray Derma is a high margin, non-invasive anti-aging alternative requiring minimal training, which leads to increased patient throughput, expands accessibility, and seamlessly complements existing treatments. So in cosmetics and skincare, innovation will normally follow the same blueprints, some small improvements over the same existing invasive techniques, right? So the challenge for us was not just to create a solution that is more effective, but is also safer, suitable for a wider range of patients, and requires the need for less specialized training. So treatments like Botox were revolutionary for their time, but we believe that Ray Derma is the step forward. So the problems with Botox. Botox requires injections, right? And injecting requires years of training to get consistent and reliable, right? You don't want to be screwing that up. And there's also some non-negligible risks of adverse effects like allergic reactions, nerve damage, droopy eyelid headaches, and potentially even some neurological issues. So the demand for safer, non-invasive alternatives is growing, and we believe Ray Derma is the solution. So venoms and skincare, they seem like an odd pairing, right? But there's already been some products out there that utilize bee venom and cobra venom to some success, and even something as outside the box as royal jelly, which is what bees feed their larvae and the queens, have been used in cosmetic products, right? So this got us thinking outside the box. Nature is providing us with a wealth of potential active ingredients. Could stingray venom be next?
Uses stingray venom as an anti-aging solution. Stingray venom contains hyaluronidase, and hyaluronidase enhances topical absorption by breaking down hyaluronic acid, and this is our key anti-aging ingredient. This ingredient improves skin permeability, allowing creams and serums to be more effective for anti-aging purposes, and it works by moisturizing and smoothing the skin and makes hyaluronic acid more effective. And despite their potential, stingray venoms have remained largely unexplored in terms of cosmetic research. And Rayderma, our product, harnesses the untapped potential of stingray venom to create a customizable and non-invasive anti-aging solution. And some key advantages are there are a wider range of suitable patients. So Rayderma could be used for people who don't like needles or are allergic to Botox, and it can also be used more as a preventative treatment in younger patients who don't want to commit to getting Botox just yet. And it's also more efficient and accessible. Less training would be required because it's a topical solution rather than an injectable solution, which would make it easier to integrate into dermatology practices. It also would not have complications associated with injectables, and it also could have higher patient throughput for dermatology clinics because it would be faster to apply a topical serum as opposed to an injectable. And these Rayderma could be a customizable anti-aging formulation. Stingray venom properties are variable across stingray species, different stingray ages, different stingray sexes. So once we know more about the venom, we could tailor it to be specific to the patient's need.
So aging gracefully and pain-free is a growing market opportunity. Skincare is booming. It's $40 billion market in 2023, and it's $100 billion projected by 2030. This includes higher buying power from women with increased incomes and increased investment from men, especially. It's grown 68% by men since 2022. But we said there's a critical market gap for a topical, needle-free, science-backed anti-aging solution such as Rayderma. So we'll focus on appealing to younger consumers seeking preventative skincare. Our market strategy will be to first focus on our primary customer dermatologists, and so we will exclusively sell to licensed professionals, and our marketing strategy will be to target conferences and medical journals, and with our clinical trials, we can also incorporate marketing. And our strategic partnerships will be with research institutions, and then we will also theoretically model our formulations to minimize the testing needed. And our key costs will be an initial investment to set up the venom extraction and processing, and then our premium branding for marketing, luxury packaging, and brand positioning. And finally, our clinical trials and quality control to include research, testing, and regulatory compliance. And here's our BMC.
Right, so in summary, Rayderma fills an important gap in the skincare market. Yeah, I had something else I was gonna say. All right, so combining the expertise of chemist, a biologist, and a physicist, strike back against aging with Rayderma. Thank you.
Can I ask you a question? And I also want to know, after I can let you go without understanding, to get the venom, what happened to the stingray venom? You have to tell me before I leave, because I'm not gonna say. Hopefully the ray doesn't die in the process.
Okay, so stingray spines regenerate, so we would be able to remove the spine, and then it would probably be easier to keep the same ray, let them regrow the spine.
Okay, I just feel better because that was like I couldn't. My question is, why you pick the dermatologist customers versus, on one hand, even making a consumer product, which seems like there is no injection, whatever, so someone could literally do it.
Right.
As well as potentially licensing just the venom to a skincare manufacturer, for example. So I was curious to see why you picked that specific segment.
Right, so licensing it out to other brands was something we had not considered. That would be a really good avenue. We went with dermatologists because we wanted this hypothetical product to be of a similar strength as Botox, and something like that is not available over the counter, right? That has to go through either a Botox clinic or through a dermatologist. So that's why we went with just dermatologists.
Good afternoon, everyone. My name is Newton. Along with my colleagues, Darahi, Emily, and Omar, we are excited today to talk to you all about our product, Physiology Solutions, a better way to monitor your gut health. Because so many Americans suffer from metabolic disorders, it is important for there to be a more less invasive way to examine the impacts of the food we're eating, which is where Physiology Solution comes in to help you take control of your gut health. So which is why Physiology Solution proposed to form partnerships with wellness centers. This will benefit the wellness centers by allowing them to increase the revenue by selling our microbiome testing kits, while we handle all of the processing and data analysis, which will enable them to sell a premium service of ongoing gut health monitoring for their patients. So now some of you are thinking, why is it so difficult to monitor your gut health currently? Well, whole fecal samples are uncomfortable and messy, and the sampling collecting method puts a lot of people off. Going to the hospitals have long wait times, and doctors actually have very little nutritional training. So in comparison to Physiology Solutions, we boast an easier sample collection by enabling the patient to collect their sample directly from the toilet paper, and then storing this application sample in our storage solution to be shipped off for processing. This will enable a faster turnaround, and then we also will provide content to enable our clients to become more informed about their health going forward.
Delays at hospitals and discomfort around sample collection, in-person testing for users, we identified wellness centers as our customer segment. So wellness centers thrive by offering health center products and programs to their customers, and the ability to offer microbiome testing requires particularly expensive laboratory space, equipment, and additional staffing. So by connecting with wellness program directors who sell our kits, wellness centers, either with or without access to laboratory space, can immediately offer these kits to their customers while we handle the sample processing, analysis, and return of results through personalized dashboards. And from growing trends in the wellness industry and personalized testing, we estimate that wellness centers can expect a 5% increase in new customers annually, specifically based on the interest in microbiome testing. And so Physiology Solutions, as a result, will offer subscriptions to the wellness centers for the dashboard and as well as for the kits, so that wellness centers can stay on top of easy ongoing customer interface as well as inventory maintenance for the kits. And so understanding our target customer segment allows us to tailor our relationship building strategies effectively and to leverage the appropriate channels in order to engage with the wellness centers in ways that resonate with their specific needs.
So making this connection with the wellness centers is just the beginning. We want to foster long-term relationships with these wellness centers, as well as help them strengthen their connections with their customers and potentially help us well with the retention of new customers. So we plan on doing this by offering ongoing customer support, as well as delivering this personalized dashboard that is available both through the website and an app. So you can easily access that. And this will provide a platform for the nutritionists to share educational content, dietary plans that are based on the results for these customers. This platform will also serve as a community forum where customers can interact and share about their process and their gut health journey.
Okay, so now that we've explored how our personalized dashboard, website, and app will empower wellness centers to support their customers with educational content and community, let's uncover the vital processes that will make all of this work. Physiology Solutions will drive value through three key activities, the first of which is accurate testing and analysis. Using laboratory equipment and data and cutting-edge data analysis tools, we would aim to deliver precise results. As such, partners like lab equipment suppliers and regulatory and compliance consultants will ensure the reliability of the results, which lays the foundation for what follows, which is the personalized health insights. We need a software that would be able to transform our data into tailored wellness advice that's enriched by educational content as well. So collaborations with healthcare providers and research institutions will allow us to make these health insights more actionable and impactful for the consumer. Lastly is, excuse me, is efficient sample handling. Using sample preservation techniques, this will create a streamlined process. Partners such as shipping companies and Zymo Research will guarantee a fast, seamless delivery and also enhance patient sample stability from anywhere in the United States. Together, these three activities will create an effective workflow that will allow wellness centers to offer this premium service to their customers without incurring additional operational strain. Now that we've covered how our key activities drive value, let's shift to the financial picture. On the cost side, we would expect to invest heavily in the resources and expertise needed to make our operations function. We would have to invest in cutting edge testing technology, smart software for the insights, and also the logistics to move samples flawlessly. Overall, it's a big picture commitment to quality and efficiency. And on the revenue side of things, we have two direct streams. Testing kit sales, which bring direct income from the wellness centers themselves, and also subscriptions offering recurring revenue through kits and dashboards, which the wellness centers will have to purchase to use our software. Ultimately, we hope that this balance will empower wellness centers to equip their customers with the necessary metabolic tools to take control of their health. And with that, thank you so much for your attention, and we'll happy to answer any questions from the panel.
Frequency of testing for a customer that would imply some kind of difference in health? Is this as far as their health, their microhealth?
Sorry, you're asking
Is this something you test once a month, once a year, once a week? What would be the normal frequency of testing for it?
So depending on their health goals, depending on what metabolic issue, whether it be just losing weight or if they have an overlying issue, it could be ranging from once a month, once a quarter, depending on the discussion they'll have with their wellness center and even coordinate with their healthcare provider. They'll have a discussion, have a coordinated plan to collect data on the impacts of any type of dietary shifts on their gut health.
Okay, thank you.
Good afternoon, everyone. My name is Nolan, and I'm here with my team, the Vascular Virtuosos, to talk a bit about our technology for early heart failure screening via just a simple blood draw. So as we're planning out this project, I'm thinking to myself, when was the last time I went to a cardiologist? Well, fortunately, I'm young and I've been lucky enough to not have heart problems, so I've actually never been to a cardiologist, right? But most people probably don't have a regular checkup with their cardiologist, and that's a bit in contrast to how we handle other big diseases, especially in the United States. So for something such as colorectal cancer, you have about a 1 in 25 chance of having that at some point in your life. And even for that low chance, we have that famous, you turn 50, you go and you get your colonoscopy. And then about every 2 to 3 years after, depending on family history, there might be some kind of screen. For breast cancer, this can affect 1 in 8 women in their lifetimes. And they should be doing self-screens every month with a more professional screen about every 2 years. Now for heart failure, the target of our technology, which has about a 1 in 4 chance or 1 in 4 lifetime risk for people. We screen for heart failure actually about never. There's no usual heart screen that you go through for heart failure over the course of your life. Rather, it's treated based on symptoms, and you maybe get sent into a cardiologist for more invasive testing. And that's what our product is seeking to solve. So what we're working with is a technology called a liquid biopsy. Now, this is opposed to a solid tissue biopsy, which uses a tissue sample. Instead, we're using blood. So this is just something that can be added on to your normal blood panel that you get every year at your primary care physician. Our technology is based on this idea that DNA is released by cells that are dying into the bloodstream. And the DNA that goes into the bloodstream from perhaps cardiac cell death can then be sequenced, and those epigenetic marks can be traced back to the tissue of origin and can also give us some information about the kinds of cells that are dying and perhaps the pathology that a patient might be experiencing. So there's a clear gap here in screening needs for the most common diseases that we have in America. And how often we're actually checking these people for disease. And so our solution is a low cost, minimally invasive, it's just a blood draw to screen for early detection and treatment of heart failure. And the early detection part is important because once you get to having a lot of symptoms, your costs are already going to go up as the customer, which is something that Wonka will talk about a little bit later. But we anticipate a large impact for this with the heart failure costs in just the United States being about 70 billion projected by 2030. And even smaller scale studies that have done more invasive constant checks for heart failure have already had fewer hospitalizations and a lot of savings per patient. So Wonka will tell you a little bit more about the customers.
So yes, our end user are the patients. However, our customer are the health insurances. They will have the highest decrease in expenses due to the decrease in claims for expensive treatments and hospitalizations. Further, the university hospitals are going to be our decision makers. We have to convince them that this is a good thing to do for our patients. Further, we estimate that we will have around 130 early buyers and we will be able to sell around 22.5 billion tests per year in the US. So this will only be possible if we follow 4 strategic steps. First, awareness. Through professional conferences, scientific journals, and a direct sales team, we gotta make sure the world knows this option exists. Second, distribution. Through integrated delivery networks and hospital group purchasing organizations, we have to deliver this product to the end user. 3, adoption. We need to make sure our product and our results is compatible with existing technologies such as the electronic health record. And 4, development. This will only be possible if in parallel we have a research development and we have a day-to-day follow-up in the clinical practice. All of this will happen if we have our key activities, which will make sure our product is a success. Through quality assurance, we will make sure we deliver the highest quality product, while regulatory approval will ensure we can legally sell our product in the market. Data management will ensure we can develop and perfect our methods, while customer support will ensure that we assist our customers and our end users in their journey. This will only be possible with our key resources, such as very specialized laboratory equipment, intellectual property, bioinformatics to be able to extract the insights from this data we're obtaining from the blood samples, and a sales and marketing team to be able to start our product, but also expand its growth.
Yeah, and then moving into looking at the revenue from our key decision makers, hospitals will be able to take on this technology, our blood-based heart failure screen, because they'll see this as a major technology advancement, and they'll likely make the decisions at the end of the year budget planning process. Hospitals take about 9 months to 1 year to adopt a new screening technology in their portfolio, and we're expecting that hospitals will pay about $500 per blood test, and this will include the collection tube and other analysis reagents that they need for their users. And then moving into the costs, looking at our fixed costs, these are for our company and other infrastructure of salaries and benefit, rent and equipment, IT infrastructure, and regulatory fees. And then our variable costs will help us grow and support our customer base as well as grow our product. And this includes computers and servers, onboarding and training, sales and marketing, and contract manufacturing and continuous R&D. And in general, this is our business model canvas for our blood-based heart failure screen. And thank you for listening. We're happy to take any questions.
I'll ask a question. So this is really cool. But I'm sure as you guys know, heart failure is a progressive condition, right? So I'm interested in hearing your thoughts behind why choosing, or why do you think medical insurance companies would be your customers when we understand that, for example, on average, someone's only on particular insurance for like 20 years, right? So could you help me understand why you chose insurance.
Yeah, so we chose the insurance companies basically because, even with switching insurance companies, it still comes down to, we need to be convincing these insurance companies to purchase our tests, to cover them for the patients. So while someone could switch from one insurance to the other, I would argue that whichever A to B they switch to, we still need to convince both companies, because either way, we want them to be convinced. This isn't something that we're selling to a patient as a business to individual. Instead, it's something that we would be selling financially to insurance companies. And then the product actually would go to a hospital pathology department, which would do the processing. But we need to sell the idea to the insurance companies, financially, sell the idea conceptually to the hospital, and then also sell the idea conceptually to the patients and to primary care physicians, which would recommend that you add this to a blood panel.
Gotcha. So, okay.
Just to add to that, like the ideal world, this would just be added to your panel. So your doctor would ask for all your blood panels, and that would be one of them. And your insurance would have to cover that.
Okay.
Hi, my name is Nadine, and with my team at MediQuery AI, we are here today to show the solution we think it will work, and large hospital CMOs will apply them to their system to reduce physicians and primary care physician research time and minimize clinical decision errors if we enhance diagnosis efficiency and doctor-patient communication while delivering some benefits to the business. Patients go to their doctor for answers. I was moderating a session on patient advocacy last year in a sleep conference. And this young lady came to me, her name was Lauren, and she said, I was diagnosed by epilepsy, and I had a chance to sit down with my PCP, primary care physician, for 35 minutes. And I left my appointment with a handful of prescribed medication, a long list of do's and don'ts, and a lot of unanswered questions. She was a journalist, so she's like, I wanted to know what is my condition. She goes and starts Google, right? That's what all of us do first, to find out that she's so frustrated with the overwhelming amount of information. Next, she's like, I'm gonna research medical articles. And then she finds them very hard, complex, and full of jargons. On the other hand, physicians are spending 4 to 9 hours per week reading up on the research articles related to their patient's case. And yet they are given 20 to 25 minutes on average to meet with their patients and deliver all these important and yet complex information to their patients. My cousin is a physician himself, and he tells me that sometimes it's really hard to rush through an appointment because there's a long list of people waiting, and still knowing that your patient has a long list of questions. At MediQuery AI, we aim to strengthen the bridge between physicians and patients. With our AI-powered solution, we believe that we can help the physician to get the information in an instant manner, accurate, with a patient-friendly language, and spend less time on preparing for their consultation, and instead spend that time more with their patients. To build this gap, we have used the state-of-the-art and language AI model based on the transformer architecture, fine-tuned on medical science resources to make sure that our AI model is only being trained among evidence-based knowledge. This will help the physicians to spend less time and spend more time on healing their patients while they're able to instantly deliver accurate information. So we believe that MediQuery AI can help the physicians with less reading, more healing.
So just show that our theory is not just theory, we build it up. So we developed it in a lightweight language model based on GPT transformers. And right now you can see that, for instance, Dr. Smith could just enter the medical question, and based on the complexity and source type and the medical specialty, he could get the answer instantly in a simplified model, and we could focus on targeting rather than knowledge seeking.
Yes. So they can choose their trusted sources and to make sure that they can transfer medical based information in a more understandable language. They can also set the complexity, or if they just want to be on top of the up-to-date medical research, they can change the complexity into non-simple. We also wanted to make sure that we have benefits. We can bring in, some money. So we did some cost and revenue analysis. We are aware that we have some fixed costs, such as developing the technology and infrastructure. And once done, we're going to invest some on marketing. We are aware of some variable costs, such as customer onboarding, cloud computing, data storage. And this is an estimate of the cost that we, based on our research, we came up to. We are going to start with large hospitals. Large hospitals are hospitals with more than 100 physicians or PCPs. And just so you know, just in California, we have above 300 large hospitals. We are anticipating that hospitals are willing to pay $1,400 to $2,800 per PCP per year for our B2B subscription model. And this will put us in a profitable state. Our vision is a world in which physicians seamlessly bridge the gap between medical information and patient care, and they can spend less time reading and more time healing with MediQuery AI. With that, me and my team wanted to thank you for your time, and we are ready to take any questions.
I'll chime in on this one. AI tools for physician decision support is most commonly, I think, what it's referred to. Why PCPs and not a specialist, right? PCPs get a lot of colds and flu type of stuff that shows up. Why not? So one, why a PCP? And two, what are the specific elements of what they're researching, is taking so long? And will it really change the throughput timelines, right?
So I answer the last question first. For the timeline, based on our research, that this can help them with 50% less research time. And we chose PCP, but our goal is eventually everyone in the medical field. And that's because even for PCP, they can get various cases rather than being just a specialty on one case. So if there is a heart surgeon and they are seeing their patients daily, eventually they just maybe they're only spending 4 hours reading the articles rather than 9 hours. But if a PCP is going to see a patient for a heart failure, right, there might need some catch up on the field.
Basically, I just want to add that our niche is like in a better position with PCPs rather than just focusing on one specialty right now. So we can just fine tune our model better, and it's happening.
One of the reasons for saying, I don't mean to do a follow-up, but either a specialist, they usually have other things like imaging that they need to do the decision support with or something like that. But emergency departments, where
That's-
time is not just money, which is what PCPs is referring to, but it's outcomes
Yes.
as well.
Yes.
And they get thrown everything. I've never seen a patient with X condition,
Right.
you know, they see that every day.
Yes.
Versus a PCP that eventually they were in a pretty reasonable routine of what they're.
That's a great point. And we are aiming for large hospitals, and usually large hospitals do have emergency rooms.
So I would be cautious about just making sure that it's not just a throughput question, because even if I'm faster at research, there's other business elements that might slow down my throughput, right? Like note taking, or they just schedule every 20 minutes and I can't change that, you know, these kinds of elements, but.
Thank you.
Cool.
Thank you.
Hello, everyone. My name is Jacob Dolan, along with my team at Big Cell Energy, which includes Yasmin Alon, Minchi Zhao, Dane Martinez, and Zach Wagner. We're very excited to talk to you today about Rescue Wrap, our revolutionary new technology that boasts an impressive 10% increase in survivability over traditional gauze in traumatic situations. Our business thesis for bringing this revolutionary product into the market is that chief procurement officers within the U.S. military will purchase our revolutionary biomimetic gauze to reduce retraining costs and casualties, promote battle readiness, if we can improve critical trauma survivability by 10%. And so the problem that we're trying to solve is, of course, casualties within warfare. During conflict, casualties can reach as high as 5,000 a month. And so being able to prevent 10% of that, saving 500 lives, is immensely valuable. I mean, a human life is invaluable as is, but if we're getting into costs here, they should save the US military about $25 million a month, as retraining costs cost approximately $50,000 per soldier. And this, of course, is the direct costs, retraining, the equipment, and of course, the support for families for people who are left behind. But there are also indirect costs that we hope to kind of solve here as well, including the loss of knowledge of any individual soldier, harms to squad cohesion, and the prevention of military effectiveness, extending conflicts longer. And so our value proposition, why is this important? Of course, our value increases survival by 10%, which not only reduces replacement costs, but it is also able to reduce infections, lowering treatment costs, and enhancing healing, meaning shorter hospital stays and allowing for larger turnover of patients to make sure that people are healthy and well taken care of. And so with that, I'm going to turn it over to Yasmin to talk about our main customer base.
Thanks, Jacob. So the US military, or the Department of Defense, is going to be our top customer, primarily because of the substantial government-backed budget that already exists, our existing relationship with military training hospitals and military research foundations, and then the existing availability of the military to negotiate with agencies that are developing these innovative tools to enhance combat casualty survival. So in order to access our main customer base, we plan to integrate into the Tactical Combat Casualty Care Handbook. Now that's our long-term goal, but in order to get into that, we have to first vet our technology through military training hospitals. And so we plan to do this. We did our research. We found out there are two key players in the procurement pipeline. These are the medical logistics officers at these military and veteran hospitals that are responsible for procuring these supplies for these hospitals. And then further downstream, the supply chain officers at the defense logistics agencies that are responsible for the military at large and their procurement of these supplies. So with that, I'll hand it over to Minchi.
So the success has on the two parts. First is providing the clinical values, and second is the secure the bulk contracts. We need to show the effectiveness of in the real world trauma cases. And by securing the long-term deals, we are able to scale and widespread adoption. For the fixed costs, we stay low with maintaining the long-term deals. And for the variable costs, we're covering the R&D, logistics, and competence. With this plan, we are ready to improve the battlefield cares. And now I hand over to Dan.
So our business model focuses on direct sales to DoD procurement agents. So really our goal is to be able to secure direct military contracts, and through this be able to minimize the need for distributors or middlemen. As a result, it allows us to focus more on fulfillment of high volume sales, and through that be able to now reduce
the need for distribution expenses. And through that, also be able to provide a competitive pricing, and collectively through this, be able to maximize our profit.
Now, while the military is our primary customer that we're going after, we recognize that there's some caveats that come with trying to get military contracts, which include potentially some long timelines between initial funding and actual product procurement, as well as fluctuations in the actual demand of these types of products that are oftentimes dependent on active combat. And so what we decided was to actually try and target EMS as an additional business. It's a strategic expansion into an adjacent market where an EMS teams face critical wound care scenarios every single day, creating a more consistent source of demand for this kind of innovational product. And so using a background in military applications, we think that this would be a good way to, expand our customer sector and then set us up for immediate as well as long-term growth. And we do that through three simple steps. First, we want to introduce Rescue Wrap into EMS agencies. This is going to be by partnering with local EMS agencies as well as going through pilot programs, which will allow for the initial adoption of our product. Next, we want to keep Rescue Wrap in the market by embedding it as a standard issue product for a lot of gold standard treatment. And then in addition, we want to continue building good trust relationships with these teams that we partner with. And then lastly, to expand into others, while we want to always try and encourage growth within the existing accounts that we have, we also would like to partner up with additional rural and urban agencies that will allow us to continue our growth with Rescue Wrap. And so collectively, by trying to target both the military and EMS sectors, we can set ourselves up for immediate growth or immediate return as well as long-term growth of our product. And so this is the business model canvas that we have for Rescue Wrap, and we're happy to answer any questions.
As somebody, I have a tourniquet and the Israeli clotting bandages in my car. That's a quick kit. So how is your product different than the Israeli tourniquet?
That's a great question. So the Israeli product that's on the market mostly just includes anti-clotting agents, but we have several biologists here. I myself focus on mitochondrial biology, gastrointestinal metabolism. So we're hoping that in addition to clotting agents, we're able to also provide specific wound healing modules, as well as things that can improve metabolism to the area, and growth within that area is going to be essential in trying to regenerate, especially targeted tissue, and how the body kind of heal itself.
Just for the extremities or for the torso as well?
Extremities would be better. Torso, obviously, there's sometimes only so much you can do.
Good afternoon, everybody. I'm Piyashi, this is Baha, Rukia, and Huiming, and we are Team Walkwell. Anybody can get injured, but our bodies have this amazing ability to heal and rebuild itself. And that is the power of rehabilitation. I have been working in this space for about 6 years now and have found that no fancy technology has been able to replace physical therapy. However, traditional physical therapy has its downsides. So talking to physical therapists, I found that they want better patient compliance and engagement, feedback personalization, and a lot less of the paperwork and efficiency so that they can improve patient outcomes and therapeutic efficiency. Now, when I brought this up to our team, we combined our collective unique research experiences to come up with Walkwell, a smart gait rehabilitation system. Walkwell uses wearable sensors and projectors to provide visual projected feedback, personalized therapy, automated performance reports, thereby removing the burden from therapists to make rehabilitation more engaging and efficient. And so today, we will be presenting our plan to make Walkwell a successful business.
Thank you. So the value we bring to PT and rehab centers is increased therapist efficiency by nearly 15 to 20% by automating the paperwork, by automating the performance reports produced by our system, which will bring down the administrative costs of these centers. Additionally, we will improve patient engagement and rehabilitation, which will increase the revenue for these facilities. So our main customers at these centers are going to be the clinical directors and PT and rehab specialists. They will be the key decision makers in acquiring our system. And the way we reach out to them is through direct sales. And we believe that with a dedicated sales team, we can achieve a new client acquisition of 20% within 6 months. So we will be monitoring our sales team and ensuring that we reach this growth metric. Now, the most important way we build and maintain as well as grow our relationship with the customers is through strong training and customer support programs, which we believe we can reach a 90% client retention rate with proper engagement. Now,
So our business model revolves around 4 key activities: product development, clinical trials, sales and marketing, training and customer support. The AI-driven guidance will improve the physical therapy outcomes by 25% compared to traditional therapy. To achieve this, we will need the resources, including expert staffs, clinical data, and medical validation, sales and distribution network, and support and training system. We will collect data from 5,000 patients to achieve the accuracy and personalized data set to train AI model. In the initial state, we will build a partnership with the physical therapy and rehab centers that will increase adoption by 40% in the couple of 2 or 3 years. Other crucial partnership will be academic institution and the insurance companies. The research and institution partnership will increase the grant funding opportunity by 20%, and the insurance partnership will increase the adoption by 30% once the insurance reimbursement is secured.
So our biggest cost is going to be R&D. We will be developing our system. And beyond that, staff salaries, we have to pay people to get the work done. Operational costs such as the rent and bills. Marketing will be another big chunk of our main costs, especially because we will also be going to trade shows and conferences to reach out to our customers. For a variable cost, this will be mainly dominated by manufacturing, customer support, and logistics and distribution of our system. For our revenue, in the beginning, we don't expect our equipment sales to be the biggest source of our revenue. Instead, we will be relying heavily on grants and fundings, which is why partnering with academic institutions is really, really important. However, we expect as we start growing and building a customer base, our equipment sales, software subscriptions, and training programs will become the bulk of our revenue streams. Along the way, we will also develop our at-home systems, which eventually will also become the source of our revenue.
So in conclusion, our WorkWell is a smart gait rehab system, and we want to improve the physical therapy and rehab practices. And we hypothesize that WorkWell can enhance the physical therapy efficiency by 20% in 6 months. And we will build a stronger customer relationship with the clinic directors and the rehab center specialists. And we sell our system by direct sales. Our main cost will come from research and development of our gait rehab system. And our main revenue will mainly come from the grants and equipment sales. Based on our business analysis and research, we believe our WorkCell will be a profitable business. Thank you so much. We're happy to answer any questions.
So on the, you made two things in your value proposition. One was the increased workflow efficiency from the physical therapist itself, and the second was the outcomes of the treatments. So of those two, which is most important?
I think in the beginning our main customer segment right now is the clinical directors. So for them, the efficiency of PTs is the most important, because if we can improve that efficiency by 20%, we did the calculations and we're pretty much going to save them $30,000 per year per PT, which is a big amount of money. So that is definitely our main focus. But in the longer run, for insurance companies, we want, like, the better the patients do in the beginning and the faster they can improve, that helps insurance companies, because then they don't have to pay for extended PT. So for their focus, it's going to be the patient outcomes. But for our main customer segments, it's going to be the efficiency.